Those shoes that feel just a little tight, they could be causing permanent damage to your feet right now. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. After treating thousands of patients with foot problems, I've discovered that many serious foot conditions start with one simple mistake: wearing shoes that are too tight. What's shocking is that most people don't even realize their shoes don't fit properly until the damage is already done. In today's video, I'm going to reveal the 5 most serious foot problems that develop from wearing small shoes, the early warning signs you need to watch for, and most importantly, how to prevent these conditions before they require surgery. You'll learn how to properly check your shoe fit, which foot problems are reversible, and when you need to see a podiatrist before it's too late. Before we get started, please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps others with foot problems find this crucial information, and I post new videos every week with important foot health content. Most people think if their shoes don't cause immediate pain, they must fit properly. This couldn't be further from the truth. Your feet are incredibly adaptable, and they'll often accommodate poor fitting shoes for years before the damage becomes obvious. By then, what started as a simple fit issue has become a serious medical condition. The hidden danger of shoes that are just a little tight is that damage happens gradually. You might not feel the pain today, tomorrow, or even next month. But over time, that consistent pressure is reshaping your bones, compressing your nerves, and creating deformities that can last a lifetime. What makes this even more concerning is that many people are wearing the wrong size shoes without realizing it. Your feet change throughout your life. They can get wider with age, longer after pregnancy, and different due to weight changes. Yet most people continue wearing the same size they wore in their 20s. The first serious foot problem that starts with wearing small shoes is bunions, also known as hallux valgus. This isn't just a cosmetic issue. It's a progressive deformity where constant pressure on the big toe joint leads to permanent bone displacement. How constant pressure on the big toe joint leads to deformity is a process that happens over years. When your shoes are too narrow, they push your big toe towards your second toe. Initially, this is just a positioning issue, but over time, the bones actually shift and the joint becomes permanently displaced. Early warning signs include redness and a bump formation on the side of your big toe joint. You may notice that the area becomes tender after wearing certain shoes, or you might see a small bump developing. These early signs are your opportunity to prevent the bunion from becoming severe. What many people don't realize is that once a bunion becomes severe, the only way to correct it is through surgery. The bone displacement can't be reversed with conservative treatment. This is why recognizing and addressing the problem early is so crucial. The second serious foot problem is hammer toes, where your toes curl unnaturally due to lack of space in the shoe. This condition develops when your toes are forced to bend to fit into the shoes that are too short or too narrow. Toe curling unnaturally happens because the muscles and tendons in your toes adapt to the cramped position. Initially, the deformity is flexible. You can straighten your toes with your hands. But over time, the tendons tighten and the joints become rigid. The progression from flexible to rigid deformity is what makes hammer toes so serious. In the flexible stage, conservative treatments like toe exercises and proper footwear can often help. But once a deformity becomes rigid, surgery is typically the only option to restore normal toe position. Hammer toes don't just affect appearance, they can cause significant pain and make it difficult to find comfortable shoes. The bent toes often develop painful corns on top where they rub against the shoes, creating additional problems that require treatment. The third serious foot problem is neuromas, specifically Morton's neuroma, which involves nerve pain between your toes. This condition develops when nerves become pinched and compressed by tight shoes, leading to permanent nerve damage. Pinched nerves between toes occur most commonly between the third and fourth toe. The nerve becomes compressed and irritated by the constant pressure from narrow shoes. Over time, the nerve tissue thickens and becomes permanently enlarged. Tingling, burning, and numbness caused by narrow shoes are the hallmark symptoms of neuromas. Patients often describe feeling like they're walking on a pebble or that their sock is bunched up under their foot. The pain can be severe enough to limit walking and daily activities. What makes neuromas particularly concerning is the nerve damage can be permanent. While early stage neuromas might respond to conservative treatment like wider shoes and padding, advanced neuromas often require injection therapy or surgical removal of the nerve tissue. The fourth serious foot problem is ingrown toenails, where pressure forces nails to grow into the skin. While many people think ingrown toenails are caused by improper nail trimming, tight shoes are actually a major contributing factor. Pressure forcing nails to grow into the skin happens when the shoes compress your toes from the sides or the top. This pressure changes the direction of the nail growth, causing the nail's edges to curve downward and penetrate the surrounding skin. Increased risk of infection and chronic pain makes ingrown toenails more than just a minor inconvenience. The open wound created by ingrown toenails provides an entry point for bacteria, which can lead to serious infections, especially in people with diabetes or circulation problems. Chronic ingrown toenails can become a recurring problem that requires repeated treatment. In severe cases, permanent nail removal might be necessary to prevent ongoing infection and pain. The fifth serious foot problem is metatarsalgia, which causes pain in the ball of your foot. This condition develops when shoes are too small and create extra pressure on the forefoot, leading to inflammation and pain in the metatarsal bones. Extra pressure on the forefoot occurs when shoes are too short, forcing your toes to be compressed and creating excessive weight-bearing pressure. This pressure can also develop when shoes are too narrow, causing your feet to spread beyond the shoe's boundaries. This condition can lead to calluses, stress fractures, or chronic inflammation that significantly impacts your ability to walk and exercise. The pain is often described as feeling like you're walking on stones or that your socks are bunched up under the ball of your feet. Why foot problems from tight shoes don't fix themselves is something many people don't understand. Unlike muscle strain that heals with rest, structural foot problems caused by ill-fitting shoes involve permanent changes to bones, joints, and soft tissue. Foot shape and structure can permanently change when subjected to constant pressure over time. Bones can shift positions, joints can become arthritic, and soft tissue can develop scar tissue or chronic inflammation. These changes don't reverse simply by switching to better fitting shoes. Once tendons and bones shift, simple shoe swaps may not be enough to restore normal function. While proper footwear can properly further damage and may provide some symptom relief, the underlying structural changes often require professional treatment to address. Early intervention is key to preventing these serious complications. The earlier you address poor shoe fit and its consequences, the more treatment options you have and the better your outcomes are likely to be. How podiatry care can prevent surgery down the road is something I see in my practice regularly. Patients who seek treatment early for foot problems often avoid the need for surgical intervention. Custom orthotics, proper footwear guidance, and early treatment of developing deformities can halt progression and maintain foot function. Quick fit test. Are your shoes too small? This is something you can check right now. First, examine your toe. Make sure there's wiggle room. You should have the width of your index finger of space between your longest toe and the end of your shoe. Remember, your longest toe may not be your big toe. Your toe should be able to move freely without touching the front or sides of the shoe. Next, check the width. Your foot shouldn't bulge over the side of the shoe and you shouldn't feel pressure on the side of your feet. The widest part of your foot should align with the widest part of the shoe. Finally, assess heel slippage and arch alignment. Your heel should fit snugly without slipping, and the arch of the shoe should align with the arch of your foot. If any of these fit criteria aren't met, your shoes may be contributing to foot problems. Why many adults wear the wrong shoe size is more common than you think. Foot size changes with age, weight fluctuations, and injury. Pregnancy can permanently increase foot size, and conditions like arthritis can change foot shape. Yet many people continue wearing the same size they've worn for decades. It's also important to note that there's little uniformity in shoe sizes. One company's 10 might be another's 10.5, which might be another company's 9. That's why it's essential to try on and walk in the shoes to assure a proper fit. How to choose the right shoe size and fit starts with having your feet measured regularly. Essential shoe shopping tips from a podiatrist often include measuring both feet, shopping later in the day when your feet are slightly swollen, and prioritizing fit over style. Always measure both feet because most people have one foot that's slightly larger than the other. Buy shoes to fit the larger foot and use padding if necessary to improve fit in the smaller foot. Shop later in the day because your feet naturally swell throughout the day. Shoes that fit in the morning might be too tight by the evening when your feet are the largest. What to look for includes width, depth, and toe box room. The shoe should accommodate the natural shape of your foot without forcing it into an unnatural position. Look for shoes made from materials that can accommodate some foot swelling throughout the day. The best types of shoes for common foot problems may vary depending on your specific condition. For bunions, look for shoes with wide toe boxes and soft materials. For hammer toes, choose shoes with deep toe boxes that don't put pressure on the bent joints. For neuromas, avoid narrow shoes and look for styles with good arch support. When to see a podiatrist depends on several factors, but don't wait until foot problems become severe. Signs your foot problem is more than a shoe issue includes ongoing pain, swelling, or visible deformity that doesn't improve with better fitting shoes. Ongoing pain, swelling, or deformity that persists despite wearing proper footwear indicates that structural changes may have already occurred. These problems typically require professional evaluation and treatment. Difficulty walking or exercising due to foot pain is another clear indication that you need professional help. Foot problems shouldn't limit your daily activities or prevent you from staying active. If you found this information helpful, please share this video on social media. Your simple share could help someone prevent serious foot problems by recognizing the importance of proper shoe fit. Also, leave a comment below if you have a question about shoe fit or foot problems. I do my best to respond. If you're experiencing any of the foot problems we discussed today, or if you're concerned about your shoe fit, don't wait for problems to get worse. Schedule an appointment for a comprehensive foot evaluation. We can assess your current foot health, evaluate your footwear, and develop a plan to prevent or treat any developing problems. The link to schedule is in the description below. Thanks so much for watching, and have a great day.